what birth control is and the main reason it is used. However, many people don't know the scary side effects that can be involved with taking this medication, which is what I will be going over today. Women decide to get on birth control for many different reasons. The number one reason is just what the name sounds like, birth control. The main reason is to ensure that you can engage in sexual intercourse with the peace of mind knowing that most likely, because it is only 99% effective, that you will not get pregnant because you are on birth control. The number two reason is for lighter, less painful periods. When on the pill, you don't ovulate, so your uterine lining doesn't build up so much. You only have withdrawal bleeding because of the breakdown in the uterus due to the decrease in hormones, so you bleed for a shorter amount of time with far less cramping. The number three reason is PMS relief. Hormonal shifts during the second half of your cycle are the main cause of PMS symptoms. Oral contraceptives can provide relief by steadying hormones, but different symptoms require different oral contraceptives. The fourth reason is for fewer periods. Women on birth control can schedule their periods so it doesn't come at inconvenient times. Depending on the type of birth control you are on, depends how often and for how long you can postpone your period. The different types of birth control include the pill. The pill is the most common, and the pill is a tiny pill that you take one time a day, every day, as close to the same time each day as possible. You take 28 birth control pills, then during your period, you take your 7 placebo pills. The placebo pills are the white pills at the end of your pack, and they're just simple sugar pills, so you can ensure that you take each pill daily instead of taking a week and forgetting to start back up. And I got that information from healthywomen.org. The patch is a small sticky square you place on any fatty area of your body. The patch is a time-released patch and releases estrogen and progestin into your system that keep your eggs from leaving your ovaries. You change this patch weekly for 3 weeks, then have your period, and the following week you put a new patch on. That information came from PlannedParenthood.org. The NuvaRing is a small, soft, flexible, donut-shaped ring. It is inserted into the vagina where it slowly releases hormones through the vaginal wall and into the bloodstream, making it so your eggs don't leave your ovaries. You leave the ring in for 3 weeks, take it out the week of your period, then put a new ring in the following week. The reason that you don't want your eggs to leave your ovaries is because if they do, if you have sexual intercourse, the sperm can travel up and make contact with the egg, which is what makes you conceive. So if your eggs stay in your ovaries, then you won't have to worry about getting pregnant. And that information came from WebMD. So far, you're probably thinking that birth control sounds like a great idea. But what if I told you all the scary side effects and health risks related to being on birth control? A number of studies suggest birth control appears to increase the risk of breast cancer, especially among younger women. Women who take birth control have an increased risk of benign liver tumors, but the relationship between birth control use and malignant tumors is less clear. That information came from cancer.org. For each year you take birth control, you add a month onto how long it'll take you to conceive. For instance, if you're on birth control for 12 years, you can expect to have to wait around 1 year to be able to get pregnant. While this isn't the case for all women, it's a general rule of thumb for most. That information came from Mayo Clinic. Some physical and emotional changes take place and are permanent just while you are on birth control. The mild risks include weight gain or loss, emotional sensitivity, mood swings, decreased libido, breast tenderness, slight nausea, and increased or decreased acne. The severe risks include increased risks of cervical and breast cancer, increased risks of heart attack and stroke, migraines, high blood pressure, gallbladder disease, infertility, decreased bone density, increased risk of blood clotting, and yeast overgrowth and infection. These are just some of the risks. I'm not telling you the pill is bad. You and your doctor will need to decide what is best for you. However, I am just providing this information so you'll be aware that birth control does have side effects and health risks that go along with taking it for some women. With an estimated 150 women worldwide who take birth control, not many research the dangerous side effects, but you owe it to your body and your future children to find out more. Now Now the choice is yours. You've heard both the good and the bad on birth control. Now you just have to decide if the risk is worth it. If you do decide not to take oral contraceptives because of these risks, please make sure you discuss other forms of birth control with your healthcare provider. These are a few pictures of what the pill looks like. And this is what the patch looks like. And that is it.